Hi everyone, my name is Liz Fox. I'm the lead APP at Stanford for the Neuro ICU team and currently the APP section chair for the Neurocritical Care Society. Today I want to talk to you about the APP orientation course. This course was developed after a needs assessment that was done in 2016 to 2017 that clearly identified a lack of standardized orientation for APPs working in a Neuro ICU. Many of our peers felt as though their orientations only contained bits and pieces of necessary information and overall lacked structure. It was also identified as a gap from organizations that were just starting their APP programs within their ICUs. After this call to action, a subgroup of our society's APP leadership section started working on developing the product. While it took us a good year to put together, it was definitely worth it. The course is comprised of 25 sections that include neurology foundations, critical care foundations and neurocritical care skills, pathology and disease and neurocritical care, and recommended procedures. Within each of these sections, there's materials to review that include ENLS, OnCall, PONZ, and a pocket guide as just a few examples. The product is comprehensive in providing a clinical orientation to neurocritical care and was designed with the concept of it being completed within the first year of a new hire. Once completed, the participants receive a certificate of completion. The overall intended audience includes those APPs new to the critical care environment, or for those that would just like a refresher. There's multiple bundle purchase options available to meet individual needs as well as budgetary needs. These include CEUs versus no CEUs, ENLS certification or no ENLS certification. There's also a discount for bulk purchases. So far, the product has been purchased over 319 times by over 140 organizations. The APP section leadership is super excited about this project and helping standardize orientation, creating successful providers to neurocritical care. We hope that you take a few minutes to look at it and consider using it within your organization or for your own practice. Thanks, everyone.
The Advanced Practice Provider Neuroanatomy webinar series is a 4-part series that covers 4 hours worth of content that was developed for advanced practice providers and other clinicians new to neurocritical care. Topics covered include neuroanatomy and lesion localization, brainstem anatomy and localization, anatomy of the brainstem, thalamus, and basal ganglia, and lastly, neuroanatomy and neuroradiology for the advanced practice provider. The Neuroanatomy and Neuroradiology webinar has received a recent exciting update to include a more comprehensive overview of neuroradiology. Participants can obtain 4 nursing contact hours upon completion of the webinar series, and the webinars can be purchased independently or as part of the Advanced Practice Provider Orientation course. These webinars are a great resource for any new to practice advanced practice provider or for other clinicians looking for a refresher course.
So I'm Dr. David Greer. I'm the professor and chairman of neurology at Boston University Medical Center. And I'm going to talk a little bit about the brain death determination online course through NCS. The concept of this came out because there's concern that we're not having entirely sound practice in the determination of death. What we wanted to have is some kind of a training course where you could do it online at your own leisure. It would be comprehensive and detailed. It would be interactive so that we could come as close to being a simulation as possible, and that people would go through actually having to understand all the core concepts of brain death in order to be certified in the end. This is a certificate course, and we wanted to make sure that people were determining brain death correctly, and similarly having to answer questions correctly, understanding where the potentials are for mistakes, the pitfalls in diagnosis. And so it was a very rigorous course. The other thing that's really pretty special about this is we have a lot of video content. And so the patients that you see in this are actual real brain dead patients. So it's a very in-depth and a simulation-based course. If you have internet, you can do this. And so that gives it a global appeal as well. We didn't want this to be only for people in certain countries to be able to take advantage of this course. We wanted to make it widely available to. And the last thing I'll say is that currently we're working on new guidelines for brain death determination that will combine adult and pediatric guidance. And so that'll be necessarily an update for this course as well once those new guidelines come out. So that is hopefully a good summary of the course and helpful for people.
Hello, everybody, and welcome to the first ever virtual NCS meeting. I'm Dr. Chitra Venkata Subramanian, Professor of Neurology at Stanford University Medical Center, a Fellow of the Neurocritical Care Society, and co-chair of the Emergency Neurological Life Support ENLS Committee for the past 3 years. ENLS version 4.0 was created with ENLS co-chair, Dr. George Lopez, and the countless volunteers, and was released earlier this academic year. It is a 14-module series that covers everything a neurocritical care practitioner needs to know in the golden hours of treating a patient with a neurological emergency, whether it's a traumatic brain injury, acute stroke, hemorrhage, or simply airway management. Key highlights of this version are updated checklists, algorithms, communication tools with simple verbiage for safe handoffs, expanded pediatric content, and a brand new section on nursing in each and every chapter. These manuscripts are accompanied by new slide decks, which are narrated by experienced ENLS instructors. Most importantly, you can take this course at your own pace from the comfort of your home or office. And once you pass the self-assessment quiz, you are certified for 2 years. I'm also excited to share 2 new developments for the coming year. The first is ENLS Simulation, which is a supplement to the regular ENLS course. This consists of several online simulation modules that cover the most common neurological scenarios that you will see, and you can practice and refine your skills in a very safe virtual environment before you head out to demonstrate your skills. In addition, we are harnessing the power of virtual learning in this day and age and starting a series of ENLS live training courses. These will run in the winter quarter of this year. There will be 3 days a week of lectures for 3 consecutive weeks, spanning across time zones, taught by very experienced ENLS instructors. You can mix and match, you can choose your day and time and attend a live ENLS course from the comfort of your home. So watch out for these announcements at the virtual meeting, and I hope to see you all at the virtual meeting shortly.
Hello, everyone. My name is Roy Pobletti, and I wanted to share with you an exciting training opportunity you can expect from the Neurocritical Care Society in the near future, a brand new course, Essentials of Neurocritical Care. This project had been years in the making and was intended to be an advanced learning follow-up to the popular Emergency Neurologic Life Support, or ENLS course. The Essentials of Neurocritical Care workshop covers a broad range of fundamental topics that provides learners with both hands-on training and direct education from experts. Participants will complete sessions that cover neurologic prognostication, multimodality monitoring, targeted temperature management, bedside ultrasonography, and advanced airway and mechanical ventilation in neurocritical care. Sessions are composed of both large group didactics and small group discussion. During hands-on experiences, learners practice cranial drilling and external ventricular drain placement, transcranial Doppler and optic nerve ultrasound, and fiber optic intubation for spinal cord injury. By the end of the course, participants will be able to discuss indications and limitations for diagnostic tests and therapies, and be able to synthesize a large amount of data to improve patient care. Under the guidance of Dr. Jean Sung and the directorship of myself and David Cedar, we were proud to have launched the first successful course at the 17th annual meeting of the Neurocritical Care Society this past October in Vancouver, Canada. Registration filled weeks in advance of the meeting, and we were excited to see a mix of backgrounds of those that attended. Participants representing countries all around the world included physicians, nurses, and advanced practice providers. They came from all specialties, including pulmonary critical care, anesthesiology, pediatrics, vascular neurology, and neurocritical care. Thank you to all the contributing authors and workshop leaders that included Christopher Kramer, Sabina Bulich, Christine O'Phelan, Joshua Levine, Fred Rincon, and Alberto Goffi. We believe that there will be opportunities to expand essentials in neurocritical care in the near future and look forward to providing this course at upcoming society meetings and events. Thank you, and we hope to see you soon.
Hi, my name is Stephen Trevick, and I'm the incoming chair of the Neurocritical Care Society Ethics Committee. I also helped to put together our neuroethics curriculum. So this curriculum was written primarily for fellows with the idea that it can serve as a part of the fellowship education in ethics as it pertains to neurocritical care, but it really has pieces and items appropriate for all levels, from attendings, NPs, bedside nurses, I think can all utilize a lot of this training. We have the general introduction to ethics, which was done by myself and Dr. Schneck. We have a presentation on the ethics of organ donation by Deepti Malayandi. We have an overview of medical futility by Michael Rubin. We have a discussion on moral distress in the neurocritical care unit by D.M. Mahanes. And then I have another presentation that I did on decision-making support and communication. We're planning to build on this year by year. We have some other ones coming down the pipeline on neuroprognostication and some other topics. And these can be presented either as slide decks with some information for presentations by faculty at your institution, or you can just pull it up and press play and hear a lecture with some slides to discuss and train on medical ethics issues in the neuro ICU. I hope you enjoy, and I hope this continues to grow and be a useful resource for you.
Hey, are you a neurocritical care nurse looking for some resources to help you improve your patients' outcomes? I'm Cindy Batista, a neuroscience clinical nurse specialist, here to tell you about the terrific NCase nursing resources that are available on the Neurocritical Care Society website. These resources include video presentations on neuronursing assessments, cranial nerves, and neuroimaging for stroke. There are also self-paced case studies on aneurysmal subarachnoid hemorrhage and traumatic brain injury. Medication dosing cards are also available. These nursing resources were created by neurocritical care staff nurses and advanced practice nurses from all over the nation. We felt the need to use evidence-based practice to create nursing resources to improve neurocritical care patient outcomes. So please get on the Neurocritical Care Society website and look for NCase to find these great nursing resources to improve the care of your neurocritical care patient.
Thank you for the opportunity to meet everyone and talk. My name is Katharina Bussel. I'm a neurointensivist at the University of Florida. I am the medical director of the Neuro ICU here, and I also lead our division of neurocritical care. But more importantly, I am the editor-in-chief for the Neurocritical Care Society online platform that is named Neurocritical Care OnCall. And I'm very excited about this platform for a multitude of reasons that I'd be happy to tell you more about. Neurocritical Care on Call is a subscription-based, up-to-date, comprehensive online resource that was developed and conceptualized by the Neurocritical Care Society and has not been around for very long, was only launched in the summer of 2018, so just shy of going into its third year. The special thing about this online platform is that it is super easy to navigate. It has a variety of chapters that contain tables, figures, videos, and other media, and allow the user to browse around, read in succession a whole topic, or just pick certain single aspects that they wanted to look up. And the chapters that are covered are really the core of what any practicing neurocritical care provider needs to know for neurocritical care specifically. The platform is not thought to be a general critical care textbook, so it is vastly different in really focusing on the nitty and gritty of practical neurocritical care, and includes on these topics 21 chapters, and those are being expanded with more topics as we develop them. Another really cool feature about Neurocritical Care on Call is that it is curated and drafted by a team of really multidisciplinary experts in neurocritical care, all authors that are members of the Neurocritical Care Society, but more importantly are known to be specialists or particularly interested and experienced in this very field. So you'll get updates and literature from the experts that are right there, which is amazing. And given that there are also in the Neurocritical Care Society, there are around, and they can be even approached in some instances if necessary. Moreover, because it is not a textbook, the Neurocritical Care on Call platform is updated every 6 months, so it reflects really the latest data and knowledge for each chapter and does not lag behind like textbooks often are, which is a wonderful feature. Everything that's new within the past 6 months will be added and incorporated in, and allows really to stay up to date with everything and on the pulse of what is going on, whether you're on call or not in the neuro ICU. And then my favorite feature probably for Neurocritical Care on Call is that it is covering topics from many angles. It has a theory section usually and provides the background like many other textbooks or platforms or literature does as well. But then it has, where it is appropriate, as applicable, a nursing section, which really allows for the angle to see a topic from what is important for the bedside nurse, what is important for patients' families to consider what to expect from which provider. Similarly, there is a pharmacy section, which is tremendously helpful as we all are working now in transdisciplinary teams with pharmacists. They are the experts with medications and their choice embedded into what is going on. So it's really neat to have these specialists input into the chapters, and it all embedded, which allows to see things from these many various viewpoints and incorporate it all into your practice or study planning or teaching. And then lastly, Neurocritical Care on Call is a really wonderful feature, and I just alluded to this a little bit, to use it for teaching purposes. It already is being used for the Neurocritical Care Society's advanced practice provider and pharmacology orientation courses. And it is really neat for your own advanced practice providers, for fellows, for residents to be utilized in neurocritical care education, because it covers such a broad range of what is the core of neuro ICU practice, and at the same time covers that range by being updated all the time and expanded all the time to things that are coming to the core of what we practice. So overall, really exciting, and hoping to expand further quickly as possible, and moreover to be able to offer the product to anyone that might be interested and broaden its use.
Hello, my name is Gretchen Brophy, and I'm a pharmacist and professor at Virginia Commonwealth University Medical College of Virginia in Richmond, Virginia. I would like to discuss an amazing product developed by the pharmacists of the Neurocritical Care Society, the Pharmacology Orientation Course. This course is a resource designed for pharmacists, physicians, trainees, and other healthcare professionals seeking specialized knowledge as it relates to pharmacological treatment strategies. It includes organized resources covering a wide variety of foundational content, including neurology foundations and neurocritical care skills, as well as disease-specific content for an array of diagnoses encountered in neurocritical care, including infectious disease, pain, agitation, and delirium. The course concludes with recommended procedures, including immunosuppressive therapies, supportive care, medication safety, and ethics and prognostication. This product was developed as a tool to help expand the pharmacology knowledge base of pharmacists and other healthcare providers who care for patients with neurological injuries. To date, there are no neurocritical care residency opportunities for pharmacists, and so this is going to be a tool to help us in that area. It can also be used for orientation of other disciplines who may also not have the specialty residency or training opportunities available. This orientation course provides a curriculum to help those who would like to enhance their pharmacology and pharmacotherapeutic neurocritical care knowledge and skills via multiple learning platforms. It can be used to help teach residents and practicing clinicians the essentials of neurocritical care pharmacology in an effort to improve the care for our neurocritical care patients worldwide.
Hi, I'm Mirnaz Pajaman, and along with Jeff Mucksavage, we are the co-chairs of the Pharmacotherapy of Neurocritical Care series, also known as PONZ, which is a subcommittee of the pharmacy section. PONZ was born out of a need for providing neuropharmacotherapy to various specialties, and it is a curriculum-based e-learning series comprised of various neuropharmacotherapy topics presented by experts in the field of neurocritical care. Now, the target audience includes individuals practicing in all medical disciplines, including critical care, emergency medicine, neurology, includes pharmacy residency directors and fellowship directors, pharmacists, advanced practice providers, staff nurses, nurse educators, neurointensivists, as well as other physicians, particularly those interested in furthering their neuropharmacotherapy knowledge. Now, PONZ can be used to update primary providers on the topic or be utilized to facilitate topic discussions among trainees. It includes core topics such as acute blood pressure management and intracranial hemorrhage, hyponatremia, paroxysmal sympathetic hyperactivity, to more hot button topics such as substance withdrawal, use of neurostimulants, cannabis use in the hospital, and DOAC reversal. And what's great about PONZ is that all NCS members are granted free access to all non-CME PONZ courses. And for the upcoming PONZ webinars, we will be introducing a more interactive learning format, as well as incorporation of case vignettes, as well as making it more interdisciplinary. And this past year, PONZ made its debut within the NCS podcast series with neuropharmacotherapy experts discussing use of neurostimulants, substance withdrawal in neurocritical care, cannabis use in the hospital, and DOAC reversal. And now you can earn free CE credit with the podcast series. Thanks, and we hope you take advantage of all that PONZ has to offer.
Hello, my name is Cassie Kronfeld, and I'm a contributing author and incoming edition editor for the Pocket Guide for Neurocritical Care. The Pocket Guide was the vision of several NCS trainee members, along with editors Marin Darcy and Asma Mohi. The goal was to create a resource by trainees for trainees. This led to pairing expert faculty with residents, fellows, pharmacists, and APPs to develop a concise yet comprehensive resource for any provider that cares for critically ill neurological patients. The Pocket Guide features 18 high-yield chapters, including neuromuscular emergencies, spinal cord injury, multimodal monitoring, hemorrhagic and ischemic stroke, and more. Each chapter includes references to high-impact publications on the topic. With the recently released second edition edited by Winnie Lau, there is now an electronic version, making it even easier to use as a quick reference while caring for patients.
I've always felt it's every physician's professional responsibility to volunteer his or her services to help advance their society. And when I was given the opportunity to help with the NCS podcast, I immediately accepted. My name is Fawaz Al-Mufti. I'm a neurointensivist and neurointerventionalist at Westchester Medical Center, New York Medical College, and I'm the chair of the NCS podcast subcommittee. It's been almost 3 years since we officially launched the NCS podcast, and I'm honored to have contributed to its growth and evolution. Although we undoubtedly went through some growing pains initially, but today, with more than 50 recorded episodes, the NCS podcast has served to highlight seminal publications revolving around neurologic emergencies, ranging from basic to translational to clinical sciences. Furthermore, we've been fortunate to have been able to partner with the Pharmacotherapy of Neurocritical Care series, the PONZ, and an Advanced Practice Providers Committee to release 2 mini-series to promote their work as well. Despite the COVID-19 pandemic, we're determined to reestablish some degree of normalcy, and while adjusting to our new reality, we're able to continue to release our episodes on COVID and non-COVID related topics. Not only has it been an absolute blast for my team and I to interview leaders in the field around the world every month, but we've been absolutely honored to know that our podcast has been downloaded over 60,000 times by people from all over the world. Over the coming few years, we plan to launch our Stump the Professor series, covering challenging cases and controversies in neurocritical care, as well as our own fellow journal club that will coincide and collaborate with the Twitter Journal Club. The NCS podcast has allowed us to promote our society, the work of neurocritical care professionals, and to advocate for our patients and improve the general public's knowledge and recognition of neurocritical care and the research we all participate in. I hope you enjoy this episode.